Okay, now we're going to talk about a problem that can present when the baby is malpositioned or the baby is very high in the pelvis and the water breaks and comes down and allows the cord to present before the baby presents. This is called a prolapsed cord. So Miss Sims is our patient, and she is now complaining of her water breaking. The first thing you do when the water breaks is you listen to the fetal heart tones. We don't want to hear any changes in the fetal heart tones, and if we look up at our fetal heart tones, and I'm going to zoom in, we can see that Miss Sims is having some variable decelerations. This is not a good thing. Variable decelerations can mean that the cord is being compressed and causing the heart rate to go down, and you can see it's nonsensical to the contraction pattern. There were no contractions, now we're having a contraction and we're having this compression. So the first thing you're going to do is listen for fetal heart tones. We have a suspicion that we may have a prolapsed cord because we see variable decelerations on the monitor. And then the next thing we do is we are going to do a vaginal exam, and Jenny is going to do a vaginal exam. She is going to put her leg back, and then of course she puts on her sterile gloves. Okay, and Jenny is going to check to see if the head is applied well or if there's a cord. Now, when we go in, we can
seeing a cord.
Jenny, can you put this other leg back up a little bit more so we can see if we can see? Okay, so can you show me where you see? Oh, I see a cord.
See a cord?
The cord is actually presenting. So you don't want to touch that, right?
Right.
So the first thing Jenny's going to do is apply a firm pressure to this presenting part, and that's going to take the pressure off of this cord. Now you'll see that Jenny is putting the head down, and this will change gravity. And what we're going to do is Jenny's going to put her head down and the patient's feet up, which is called a Trendelenburg position. And this is going to let reverse gravity, help us to push the baby back towards the fundus. And you can see Jenny doesn't have to press as much. But she's still going to keep her hand here and elevate the presenting part until we get to the C-section and the surgeon takes the baby out. Now Jenny's going to call for help. Can I help you?
Yes, we have a cord prolapse in here, and I need you to get the doctor in here, and I could use some extra hands.
Okay, we'll be right in.
Okay.
And now Jenny's going to start talking to the patient and explaining to her what's going on.
Miss Sims, we're just having a little bit of trouble here. We've got the baby's umbilical cord trying to come out before the head, so I'm just taking some pressure off of the umbilical cord so we can keep that heart rate good. We don't have any compression, and we're getting the team here. We're going to have to go back for a C-section, okay?
Okay,
Everything's going to be okay, and we're going to take good care of you.
Okay, so now Jenny, so we take the patient back. Jenny's going to ride in the bed. So Jenny's going to get on the bed because her hand never leaves. Once she has found the prolapsed cord, her hand never leaves. They'll drape her in the C-section room in the OR, and she'll be under the drapes. And now what we're going to do is I'm just going to show you guys. Jenny, can you take her skin off so we can kind of show them what this is going to look like? So when they do the incision, you can see where where Jenny's hand is pressing up, and the cord is presenting in front of the baby, and it's a little bit difficult to see, but the cord, you can see the cord there. So what they'll do is Jenny's hand will remain there until the surgeon makes the incision and actually takes the baby out. So then they'll guide the baby out.
We'll meet hands.
Right? Because it's really taut in there. So they'll get the baby's head out. Now Jenny won't be doing this, the surgeon will be pulling the baby's head out, of course. And now once the baby is out, then Jenny can remove her hand away. So that is a prolapsed cord. So know your risk factors. Your risk factors is abnormal positioning, Baby in a high position, -3, -4, up high in the pelvis, where there's lots of fluid in front of the baby's head. And then, of course, variable decelerations are a big cue that there can be some cord compression. Of course, the nursing interventions would be to listen to the fetal heart tones first. Number 2, verify that there is or is not a cord. Once you find a cord, you press and elevate the presenting part, put the patient in Trendelenburg, call for help, and then it will be a stab C-section. Thank you, Jenny.
You're welcome.